Weight gain, an Instagram influencer's worst nightmare. But the only thing worse than putting on a few pounds is getting diabetes. Diabetes is heavily linked with obesity. Generally speaking, the more you weigh, the higher your A1C. A1C is a measurement of your blood sugar levels over the last 3 months. We want this number to be low. It wouldn't be fair to just say that overweight people are at risk of diabetes because there are also a good amount of people we like to call skinny fat or even with a low BMI that can get diabetes, but that is much less common. Weight and diet is a big risk factor for diabetes. Comment below if you'd like me to make a video on that next. But anyway, a new study just came out comparing medications and lifestyle to bariatric surgery for the treatment of diabetes. Currently, bariatric surgery is only approved for those with a BMI greater than 35, and weight loss medications are only approved for those with a BMI greater than 27. But did you know that anyone with any BMI can lose weight with diet and exercise? And we all exercise, right?
Absolutely, I do.
When it comes to reversing diabetes, there are two massive, and I mean massive factors. One is your sugar intake. So put down that delicious, savory, juicy donut and pick up that delicious, savory, juicy broccoli. Look, it's no secret that vegetables don't taste great while pancakes melt in your mouth. But you don't need to be like this guy or this guy or this guy who's telling you that if you so much as look at a teaspoon of sugar, you will die. You won't. You just need to be cautious of your intake like everything else. Will the occasional drink to celebrate your friend's birthday cause cancer? Will a Big Mac from McDonald's once every 6 months put you in a coffin? Will The Rock show up to your house tonight and give you a personal demonstration of the people's elbow? Thankfully, the answer is no to all three. So don't stress about a few grams of sugar here and there. The problem is overconsumption. Too many people are eating too many sweets and processed foods. That's why the keto and Atkins diets have become so popular and people are claiming they are God's gift to counteract heart disease. All these diets do is basically cut out sugar and processed foods. That by itself will drastically improve majority of people's health as long as their inflammation levels and LDL levels don't go sky high. The other factor to reversing diabetes is weight. Losing weight has a significant impact on blood sugar levels, and this study proves it. Bariatric surgery is basically just making your stomach smaller so you can't eat as much, so you lose weight. According to the study, losing 8% body weight from medications, dropping 9 kilograms or about 20 pounds, led to only a 0.2% reduction in A1C. However, losing 19.9% body fat, dropping 18 kilograms or about 40 pounds, led to a 1.6% decrease in A1C. That is a massive, and I mean massive, difference. Losing twice the amount of weight equal to 8 times lower blood sugar levels. There is a flaw with this study though. Look at the drugs being compared to bariatric surgery. The participants in the medication group could have been on an oral medication, an injectable medication called GLP-1, insulin, or some combination of them. They should have either required GLP-1s in all patients or excluded it entirely because GLP-1s are very effective with weight loss while the others are not. Oral medications for diabetes barely show any weight loss while insulin can actually increase weight. So you potentially have one medication that can cause a big reduction in weight loss, one that doesn't do anything in terms of weight, and another that might actually increase weight. So even though Mounjaro, which is the most recent GLP-1 injectable used for diabetes, can cause up to 25% weight loss, its effects are being countered or negated in this study by the oral drugs and insulin that have minimal or negative effects on weight loss. Not ideal for a study regarding weight loss and diabetes. I'd like to see a study where they compare GLP-1s to bariatric surgery for weight loss and diabetes management, and also short and long-term side effects. Luckily, we have a study like that right here. The results from that study are, in adults with obesity, bariatric surgery still confers the highest reductions in weight and BMI, but confers similar effects in glycemic control when compared with the GLP-1 receptor agonists. So the surgery was a bit better as a way to lose weight, but both were about equal for diabetes management. The main point of this video isn't for you to go find a surgeon and slice your stomach in half. The point is to point out that weight loss plays a huge role in diabetes management. It doesn't matter if you decide to take medication, bariatric surgery, change to a keto diet, or exercise 12 hours a day. If you lose weight, you can reverse your diabetes and become a healthier person overall. Weight loss doesn't just help with diabetes, it also helps with heart disease, cholesterol, inflammation, autoimmune conditions. Should I go on? Okay, it also helps with sleep, blood pressure, and reduces cancer risk. What I recommend is diet and nutrition always as first line, and if those don't work, then you can proceed to medication, and if that's not enough, then surgery can be considered. Now, I'm sure I'm going to get a bunch of comments telling me that carbohydrates are the devil and cutting them out completely is the only way to be a healthy person. That's like saying in order to be athletic and fit, you need to be in the gym 15 hours a day every single day. It's a little excessive. We've seen countless studies showing that the Mediterranean diet and the vegan diet are excellent choices for heart disease and blood sugar. Here's a meta-analysis on the vegan diet showing that a plant-based diet reduced the risks of cardiovascular mortality and development of cardiovascular disease by 8.1 and 10.2% respectively. Healthful plant-based diets, including higher intake of whole grains, fruits, vegetables, nuts, legumes, tea, and coffee, were found to have protective effects against cardiovascular disease, whereas unhealthy full plant-based diets were found to increase cardiovascular mortality. Our results on an overall plant-based diet and lowered risk of CVD are broadly consistent with prior studies which found a lowered incidence of coronary or ischemic heart disease among vegetarians compared to non-vegetarians. Keto and Atkins and some of these newer fad diets are still under research, and we are not entirely sure of their safety long term. Short term, they can be very useful to lose a bunch of weight relatively quickly, but again, long term, it's hard to say whether they are better options than the Mediterranean or vegan diets. One thing that is for certain, put down the candy bar and pick up the kale. Check out my video on how sugar affects memory, and I'll see you all next time. Thank you.